This is Public Health Week. We're almost entering the last days of it. And this is our opportunity to really acknowledge and lift up the contributions of public health. And I think during this time, as we're trying to deal with this virus, is a wonderful time to really illustrate how vital and essential public health is. And it's important because public health is that entity that really tries to investigate and find out what's going on with the disease. And so we get out front and begin to work with numerous partners to really address this, because we can't do it alone. So it really illuminates the importance of having partners and being a good partner. So we need to, when we get a case, we need to investigate that case and find out who they've been in contact with and make them aware that they may have been exposed, so we can kind of contain the virus from spreading. So that's one of the major things we do. But also we spend a lot of time communicating with the public and with our stakeholders, letting them know what the guidance is in terms of what they should be doing to keep themselves safe. Social distancing is important so that people are not close enough to spread the virus. This is a real insidious virus, and it's by droplets and in the air. And so the closer you are, the more chance you have of spreading it. So if we can keep our distance, then they talk about flattening the curve. And so instead of it keep going up and up and up, then it'll begin to flatten out. And we need for that to happen so that we can keep working on a vaccine, so that we'd be able to eventually treat it and kind of suppress it. But until that time, we need to kind of slow it down. And so keeping your distance and not being out in the community allows us to slow it down. This is an opportunity for all levels of government to work together. So we get guidance from the federal government, we get guidance from the state, and then we push out that guidance to the people in the community. And so we want to make sure that as we look at what we're doing, we do it through the lens of equity. And so for those who are on the outskirts, or who are on the margins and who are having a little bit more difficult time, that we kind of lift them up and pay attention to them and make sure they have every opportunity as well to be healthy.